all over the world, one of the challenges in the healthcare space, and indeed this is very personal, every one of us experience this, is that access to quality healthcare is a major challenge. When I say quality healthcare, it means reaching doctors who have experience of the domain, people who have insight into the problem, people who can come up with original solutions, original diagnosis of something that the patient has been struggling with. Now, this is definitely true in the developing world, but sometimes even in the first world countries, these problems are relevant. I was in the UK for many years doing my PhD and postdoc. I know for a fact that in the NHS system, for example, getting access to specialists is very difficult. If you have to get an orthopedic, it may take even a year's time. If you have to consult a psychiatrist, maybe shorter duration. But and generally getting access to somebody who's very well qualified and has a lot of years of experience is a challenge. So access to healthcare is what originally prompted us to look at Plenome, and this was especially acute during COVID time when people could not easily move out of their homes and they had ailments, and we were looking at ways in which we could enable them to connect with doctors while at the same time respecting the security and the privacy of the data. And that's how we started exploring the use of blockchain for protecting healthcare information. And indeed, this is the origination and vision of Plenome. We want to be able to solve the access to healthcare problem first, and second is that we want to enable people to access their records in a safe, secure, and digitally traceable manner. So indeed today we call ourselves as a AI SaaS company, artificial intelligence acting on the front, center, in the back. And what is SaaS about this is what solutions that we're developing through AI is offered as a software for people to leverage. Now I'll explain this in parts. You asked me about blockchain, I have started answering about AI. The reason is that blockchain as a technology originated in the financial community as a way of issuing cryptocurrencies and so on, with Bitcoin being the famous example. But the technology has actually been around within this field for a longer time. It's generally the idea of distributed ledgers, essentially, right? So it is that we are trying to use here. So while the solution is typically associated with financial sector, the technology, in the context of engineering, in the context of other applications, what we are leveraging is the ability to distribute a certain file, a certain document across many computers such that it is not easy to tamper with the records. So this is what prompted us to use it for healthcare. And when I say like this, doesn't it sound that it's immediately relevant to healthcare? Because this is the space where privacy is the most important. Right? So people, these are the sensitive personal information associated with your diagnosis, your health, and so on, which we do not want to come out in the public domain. So blockchain is a great use case for healthcare, and where I started with AI. So where this whole thing is helping AI is that in order for good artificial intelligence to work, you require good data that is structured, data that is well organized, data that is authentic, data whose provenance can be traced to the origin. All of this is ensured by blockchain. So this is what Plenome is doing, bringing the power of distributed ledger technologies to medical domain so that we enable clinical AI. So healthcare is a domain where the provenance of data is very important. So for example, the information flow is usually from the patient into the hospital, to the doctor, and through the various arms of the hospital, and then back to the patient as insight, right? We do not want anybody intruding into this information flow, and this is where blockchain comes in. Blockchain as a tool for cybersecurity may not be the first preferred solution. There are traditional solutions available, but blockchain is definitely one of the most effective, one of the most pragmatic solutions for ensuring cybersecurity, and this is where we are using blockchain. When we say blockchain as a service, what we are offering is really the ability to secure data in this manner and then feed it to companies that are doing AI, for example, and today we ourselves have started doing AI, and that's the service that we are offering. we have field testing the solution at several places. The first implementation was at IIT Madras, of course, a couple of years ago. But then that was not as a company at that time. That was as a research project. So we got a lot of feedback. The first thing that we really understood is that the IT infrastructure penetration in the hospital segment is a lot to be desired. And that's what enabled us to develop our solution in the form of a hub device, which can be given out as hardware that can be given out in places where there is not enough penetration of IT infrastructure. And that was the first and initial insight. Of course, by doing our field trials at several other places, we understood one more thing, that while we talk about electronic medical records, electronic health records, the need for it and so on, the hospital is a very chaotic and messy environment in practice. There can be emergencies, patients are coming in and going, doctors are harried all the time, they're meeting 20-30 patients in a couple of hours. So this is not an environment where you can tell them, hey, please type in the key in the information that goes into a structured record. This is how we developed our AI solution, the agent that listens in and then creates a structured medical record with blockchain on the back end. All of this came out of our pilot studies and trials. Indeed, telemedicine is close to what we started with. As I said, access to healthcare is one of the areas that is very close to my heart. In a primary healthcare center or a secondary healthcare center, perhaps people do not have access to the best doctors or the most experienced doctors, or the doctor density is very little. This is where telemedicine and teleconsultation come into place. But whenever you have teleconsultation and telemedicine, the major challenge is to create a structured record out of it, because there is nobody recording that conversation. This is where Plenome solution comes in. We now have an AI agent, we call it Ginny. Ginny listens in to the conversation, creates the record on its own, puts it on a blockchain database, also creates a discharge summary, and then there can be even medicines that can be shipped to the person. And those medicines need not be in the local district. The pharmacy can be somewhere else as well. They are just addressing that particular requirement, and then the medicine can go. This is the futuristic vision we are working on. So our work with blockchain is actually at the heart of this whole thing, right? So we have now filed for 2 patents. We already have 1 design patent on this. So the use of blockchain and distributed ledgers means that there's a few things. Access controls is native to the system. A patient can decide who is accessing the record, who can modify the record, who can add on to the record. First thing. The second thing is that we can easily remove what we call as patient identifier information from data that can be used for research, analysis, insight generation, and so on. So this is how this whole issue is solved, and blockchain ensures data integrity and data privacy to the patients. So indeed, Plenome solutions are developed keeping in mind the challenges with the global south, not just in India, but across sub-Saharan Africa and also South America. The doctor density per 1,000 patients is actually much unfavorable compared to what it should be. And our solution, which is in terms of developing a framework for guiding patients to connect with doctors through teleconsultation, and also the secure management of data records, creation of structured records, insight generation, and then agentification of AI through which patients can connect with hospitals, provides a very lean, clean solutions to this problem. You have an asymmetric possibility. So imagine a future, and this is something that when I think about it also fascinates me, is that somebody from a rural area connects to a government helpline. That government helpline is free of charge because it's managed by the government. There is an AI model running on the back end. When you call in, you tell your symptoms, the AI model searches through the database and then comes up with the first level of screening. It says, hey, your health, based on these symptoms, based on your past records, I can say that this is a very simple ailment. Please take paracetamol, take rest, you will be okay. Or it can decide that this needs to be escalated to a paramedic. Then they go to a paramedic, the paramedic treats them. Failing which, they then say, go to the district headquarters, meet a doctor with this specialization. Now, imagine the costs in the healthcare that patients run through today may be cut by 1 by 100 once the system comes into place. This is the vision we are working on. Therefore, it is a made in India solution, made for the world solution. So, the AI revolution is here to stay. We want to make use of these advanced large language models with the help of which we can bring this kind of agentification I was telling you. We have a dream in which we are building a AI data network where the participants will be not just from the country but across the world, through which we can come up with diagnosis that wouldn't be possible normally. So, for example, COVID-19. How is a particular population in a different geography reacting to the same disease, a new pandemic, right? And then these two systems, if they were disconnected to each other, you would have one type of analysis. Now you connected them. The kind of insight that you generate is unmatched. So going global is actually fundamental to the DNA of what we are doing, and this is how we are going to grow. We are going to onboard more and more hospitals into our ecosystem, into our network of the distributed data network that we are building, and we want to go towards this agentification, and this is our plan for expanding in India as well as abroad. So what we want to do is essentially make these models particularly for the healthcare and make them available to people who are building hospital information management systems. In those cases where people do not have information management systems, we also build simplistic solutions and deliver to them. Ultimately, we want to work with governments in creating these kinds of agents that I was talking to you about that can help enhance the reach of healthcare to the tertiary sector. So, for me as an academic, entrepreneurship is actually a way by which the best innovations from our laboratory can reach the field, right? So, in IIT Madras, we are developing some of the most cutting-edge solutions that are at the frontier of science and technology. Today, we are developing imaging of the brain at the neuron level, right? At the cellular level. Today, we are developing 3D printed rockets. Today, we are developing AI solutions for impacting a wide range of technologies. How do we take these things to the field? To me, that's how entrepreneurship is very personal. This is why I joined the startup movement. My first startup was 9 years ago, which was in robotics, and that was the triggering point. We had developed a robot in the lab that was working very well. We wanted to make this into a solution that industries can use, right? So, as an academic entrepreneur, to me, the whole mission is about making available our technologies to solve social and industry relevant problems. So in my portfolio today, I have startups that are working on eliminating manual scavenging, startups that are working on keeping infrastructure like bridges, dams, roads safe, startups that are working on keeping factories safe from accidents and in increasing their productivity. So there are startups that are working on automated solutions for farming. There are startups that are working on foundation models for humanoid robots. So if you see, every one of them has a particular social relevance, and there is no greater joy for me as an academic than to see my solutions being applied in the field, and startups are the vehicle to do that, and that's why I want to be an entrepreneur.